Well, the president is urging everyone to get vaccinated and those eligible to get the booster to do it now. This as the Omicron variant spreads across the country. There are now cases in New York, Colorado, California, and Minnesota. So far, everyone is reporting mild symptoms as our nation's leaders expect more cases to be reported. And doctors at ICUs across our state are raising the red flag about another surge in COVID cases, flooding hospitals. Lauren Kostick looks into the emergency plans some are considering if things don't improve.
Doctors call it a pandemic among the unvaccinated. And as we head into the winter months, some fear that could cause the worst surge yet.
I'm worried about the way the winter's going to go, and I'm worried about the people who are unvaccinated.
Dr. Gabriel Boslett at IU Health tweeted out this warning to Hoosiers, saying if you have not been vaccinated, now is the time.
If people would just get vaccinated, 95% of the people that I meet in the intensive care unit, I would never meet, and things would be normal. And so it's hard because I don't know what else to do to make people understand.
Since August, hospitals have been in surge mode with cases climbing. At that time, IU Health had 107 patients with COVID. On Tuesday, they had 328. And we know COVID thrives in cold weather, especially around the holidays when people are gathering. But this year, health officials are worried about three things: a more contagious variant, and also healthcare workers short-staffed and tired.
We are exhausted, emotionally exhausted. It's really hard to see this many people die.
And for many, it feels like deja vu. Around this time last year, Indiana reached its peak with more than 3,400 Hoosiers hospitalized. This year, the number is lower, but some worry it's just the start.
And what makes it even more difficult is that we just have a lot more patients in our hospital. We have more patients in our hospital today than we ever have.
And the thing is, it's not all COVID patients, but the concern is beds are filling up at an alarming rate, causing hospitals like Community Health Network to start preparing.
Our staff and our leadership I've instructed them this week to look at contingency plans. If every one in every 3 or 1 every 4 beds is a COVID patient, what do we do?
One option is to delay surgeries and other services, affecting even more Hoosiers in need of care.
Get the vaccination, not for yourself, but for your family member and for your neighbor, because one of you may have a health condition that needs a hospital bed and there may not be one.
Another reason to roll up your sleeve sooner than later.
Taking a look at the latest numbers here in Indiana, just over 5,600 new cases diagnosed in the last 24 hours. An increase after a long weekend is pretty normal. The concern will be if cases continue to stay this high.